is radiation an option for acoustic neuromas?
So radiation is a treatment for acoustic neuromas that has been utilized now for nearly 50 years. So it's not a new modality. And we've gained a significant understanding over the years in terms of what we understand is the characteristics of a tumor that would make it amenable to radiation. The first is to have a tumor that's not too large. We've mentioned that typically once a tumor is larger than 3 to 3.5 centimeters, it is usually causing much more pressure on the brain, and surgery would be the better option. But for smaller acoustic neuromas or medium acoustic neuromas under 3 to 3.5 centimeters, radiation is a good option. And actually, the majority of acoustic neuroma patients, their tumor at the size of discovery is well within the criteria for radiation. A second situation where radiation is a good option is when there's no need to obtain a tissue diagnosis. And what that means is that based on the symptoms and the location of the tumor on the MRI scan, it's very clear cut that we're dealing with an acoustic neuroma, and doing surgery to obtain tissue to give to a pathologist really doesn't add much other than increasing potential complications to the patient. Another option where radiation is typically recommended is that if you have a small to medium-sized tumor and you've been watching it on serial MRI scans, so you're in the watch and wait or watch and observe mode, and the tumor's been gradually increasing over time, that's usually a situation where we would say radiation would be a good option to treat the tumor. So the bottom line, the take-home message is for radiation is a good option for small to medium-sized acoustic neuromas that are either not symptomatic, meaning discovered as an incidental finding, or that are minimally symptomatic.